Hello, I'm Professor Emily Mercuri, and this is Chapter 15, Urinary System Drugs in Essentials of Pharmacology for Health Professions, 9th edition. Chapter Objectives. Upon completion of this chapter, the learner should be able to understand the 4 types of diuretics in terms of uses, side effects, precautions, contraindications, and interactions, and give examples of each type. Identify and describe medications given for acute and chronic gout, including side effects, precautions and contraindications, and drug interactions. Explain the role of certain antispasmodics used to reduce contractions of the urinary bladder. And identify the actions, uses, side effects, and precautions and contraindications for urinary analgesics to treat pain and cholinergic agents to stimulate bladder contraction. Lastly, describe the 3 different treatments for benign prostatic hyperplasia. Diuretics. Diuretics are the most commonly used drugs that influence the function of the urinary tract and increase urine excretion. Their main indication is to reduce the circulating fluid volume to help treat edema and hypertension. Diuretics are divided into 4 categories according to their action. So if you're not familiar with the renal system, I highly recommend that you review that prior to jumping into this chapter. But essentially, think of the kidneys as filtering out waste from blood. They filter out waste and they help to keep the electrolyte balance of the body in check, as well as helping to control the blood pressure. And so if there's a lot of extra fluid, what we can do by using these diuretics is we can pull the fluid into the kidneys and have them excreted out through the urine. Sometimes, depending on the type, the electrolytes may also be lost with that. So patients may need to take certain things to supplement what's being lost in the urine, but that can help to decrease the circulating volume of fluid within the body, which is really helpful for people who have swelling, who have heart failure, maybe their heart is not pumping effectively. They're going to find themselves on a medication from this category of diuretics. So the 4 categories are thiazides, loop diuretics, potassium-sparing diuretics, and osmotic agents. Let's talk a little bit about each. Thiazides are the most frequently used type of diuretic, increasing the excretion of water, sodium, chloride, and potassium. Thiazides can be used to treat different conditions such as edema caused by cirrhosis or heart failure, hypertension, and the way that they work in hypertension is they reduce peripheral vascular resistance, and then they also reduce the overall amount of volume circulating through the body. And so a more wide blood vessel plus less fluid going through that is going to lower the pressure. They're also used for prophylaxis of calculous stone formation in those with hypercalciuria, which is excessive calcium in the urine. Interactions include nonsteroidal anti-inflammatory agents because it can increase the risk of renal insufficiency and reduce blood pressure control. Corticosteroids, which can increase potassium loss when used in combination with a thiazide diuretic. Lithium, because it can cause lithium intoxication. Hypotensive agents, because it can potentiate blood pressure decrease. Digoxin, this can cause increased potential for digoxin toxicity. Anti-diabetic agents, because it can lead to loss of diabetic control. So we're, altering the fluids, electrolyte status, all of that within the body. That can also alter the sugar. And then probenecid, because it can block uric acid retention. Example of medication given here is hydrochlorothiazide. Side effects of these medications can include hypokalemia, so low potassium because you're excreting potassium, muscle weakness or spasm, postural hypotension, meaning when you go from laying down to sitting to standing up, it can cause your blood pressure to drop, vertigo, which is a sensation of the room spinning, headache, and skin conditions including rash and photosensitivity. Now, most of these side effects can be contributed to electrolyte imbalance and or fluid imbalance. So, hypokalemia, when you think about potassium, it is a very important electrolyte for maintaining the heart rhythm. It is one of those that is exchanged in the process, the electrical process of the heart beating. And then it's also exchanged in making the muscles move, making everything work within the body and in muscle. So, we have to, usually people who are on a thiazide, oftentimes they're also on potassium replacement. Precautions and contraindications for thiazide can include diabetes, history of gout, severe renal disease, impaired liver function, and greater sensitivity to thiazides in older patients. Anytime we're talking about a patient who already has severe renal disease, they will get very fluid overloaded because their kidneys are not able to process and make urine. They'll also have electrolyte imbalances. That being said, the way that these work, they can't create and pull fluid. They can't pull something from nothing. So if the kidneys are not working well enough to create urine, the thiazides can't really overcome that. And so people who are in severe renal disease or renal failure, they have to end up doing a process called dialysis, where the blood is actually filtered through a machine that acts like the kidneys and then returns to the body. The next category is loop diuretics, and loop diuretics act directly on the loop of Henle in the kidney to inhibit sodium and chloride reabsorption, which in turn inhibits water reabsorption back into the bloodstream. So I want you to think of water as always following sodium, because it has this osmotic gradient that occurs where sodium kind of pulls the water towards itself. If we inhibit sodium and chloride from going back into the bloodstream, then the fluid will also not follow. The water will not follow, and that will lead to increased urine formation and excretion of urine. Examples of loop diuretics include furosemide, bumetanide, and torsemide. Interactions for these include corticosteroids, lithium, hypotensive agents, digoxin. So if you notice, those are all the same as for the thiazides. So very similar type of thing. We can potentiate lithium toxicity. We can become our blood pressure can be overly low if we're combining these with hypotensive agents. And then we can lead to digoxin toxicity, because those are just an interaction that occurs when you're taking a diuretic with digoxin. The other ones are different. So indomethacin. Indomethacin it decreases the diuretic effect. So if you take it with that, you're going to have a decreased effect of the diuretic. Salicylates, because it can increase the chance of salicylate toxicity. And anticonvulsants, because they reduce the diuretic effects of the loop diuretic. Side effects include fluid and electrolyte imbalance with dehydration, because again, you're pulling fluid into the urine out of the bloodstream. Circulatory collapse, if there's not enough circulating blood, the circulatory system the veins and vessels can start to collapse. Chest pain, hypokalemia with weakness, hypotension, tinnitus, which is ringing in the ears, headache, muscle cramps, mental confusion, and dizziness. Sodium is another key player in the electrolyte kind of exchange that causes the system to work. And altered sodium levels are a major thing that can cause swelling in the brain, that can cause confusion, it can even cause seizures. And so we need to think about that when we're giving a medication that involves sodium and chloride. Precautions and contraindications can include cirrhosis and other liver disease, kidney impairment, alkalosis and dehydration, history of gout, pregnancy, lactation, diabetes, and patients under the age of 18. The third category is potassium-sparing diuretics, and these are used under conditions in which potassium depletion can be dangerous. To be clear, potassium depletion is dangerous for any patient because we have to have our potassium within a certain range in order for muscular contraction, including cardiac muscular contraction, to occur. But there are some patients in which we have a greater concern about this than others based on other conditions they may have. Potassium-sparing diuretics can also counteract increased glucose and uric acid levels associated with thiazide diuretic therapy, so they may be a safer choice for our diabetic patients or those with poor glucose control. Examples of medications include spironolactone and triamterene. Interactions include potassium supplements because we don't want to increase the potassium level too high, angiotensin-converting enzyme inhibitors or ACE inhibitors, angiotensin receptor blockers, salicylates, and nonsteroidal anti-inflammatory drugs. Side effects can include hyperkalemia, so high potassium, because remember this is sparing, meaning as the other fluid and electrolytes are being filtered out into the urine, the potassium is staying in the bloodstream. Dehydration or weakness, gastrointestinal symptoms, fatigue, lethargy, profound weight loss, hypotension, and gynecomastia in use with spironolactone specifically. Gynecomastia is breast tissue formation, like unnatural breast tissue formation. Precautions and contraindications can include renal insufficiency, cirrhosis and other liver disease, and pregnancy and lactation. The last category is osmotic agents, and these are frequently used to reduce intracranial or intraocular pressure, so inside the skull or inside the eyes. These are mostly used in emergency situations that involve cranial or spinal trauma and are used to reduce the risk of nervous system damage from swelling. The medication example they give is mannitol. Now, this is something that I have seen used and I have used in the emergency department. It's also used in the ICU, intensive care unit. Those are pretty much the only places you'll see mannitol used because this is a very high-risk medication. We are pulling fluid to try to decrease the swelling within the system itself, but that can lead to further complications. It's used as a basically benefit outweighs the risk because we don't want compression on any nerve tissue that can cause the nerve tissue to die. Interactions of osmotic agents include penicillin and cephalosporins, oral hypoglycemics, salicylates, and NSAIDs. Side effects can include headache, nausea, vomiting, kidney stones, and renal colic if large amounts of fluid are not maintained. Rare side effects include hypersensitivity reactions, rash, hypertension, and anaphylaxis, which is a severe allergic reaction. Precautions and contraindications can include history of uric acid kidney stones, history of peptic ulcers, renal impairment, and hematologic disease. Notice I did not go into a ton of detail with this because, again, these aren't things you'll see prescribed normally to a patient. They are given intravenously, and they're only used in emergency situations. So these aren't ones that I am as concerned about you knowing as the others. This diagram illustrates how and where diuretics work in the nephrons of the kidney. Potassium-sparing mechanism of action. So our potassium-sparing diuretics bind to sodium-potassium ATPase transporters, which interfere with sodium and potassium exchange in multiple places in the kidney, but primarily in the collecting duct. So if you see over here at the very far right side on the bottom, that is where our potassium-sparing diuretics are going to work. That's the point in the pathway at which they're working. This causes an increase in sodium excretion while decreasing potassium excretion, which is why it can lead to hyponatremia or low sodium, and hyperkalemia or high potassium. The example medication here is spironolactone. Your loop diuretics mechanism of action. The loop diuretics bind to chloride channel receptors in the ascending limb of the loop of Henle. So ascending is going up, inhibiting the reabsorption of sodium and chloride. This inhibits water reabsorption by the collecting tubules by increasing hypertonicity. The example is furosemide. So hypertonicity, again, remember that there's this osmotic gradient where water will follow sodium. So by blocking sodium from being reabsorbed, the water is also staying in the loop of Henle, and then it is being excreted as urine, thus lowering the amount that goes back into the bloodstream. Last, your thiazide mechanism of action. Thiazides increase salts, electrolyte, and water excretion by inhibiting mechanisms for sodium and chloride transport in the distal convoluted tubule. This inhibits water reabsorption by the collecting tubules by increasing hypertonicity, for example, hydrochlorothiazide. And you can see that works up in that distal tubule, which is up at the top, and then your loop diuretics are down in the actual loop of Henle, thus the name. So if you haven't taken anatomy and physiology yet, I know that these terms may not be familiar to you, but I just want you to think of it as different parts of the nephron in the kidney are responsible for different electrolyte exchange, and that is how we know where each part is working is based on, loop diuretics. Remember, loop of Henle, your thiazides up in that distal tubule, and then your potassium sparing in the collecting duct. Just remember about which sodium, chloride, potassium, etc., which electrolytes are lost and which are spared. The big difference is really your potassium sparing. Those are where your potassium is staying while everything else is being excreted. Knowledge check. A contraindication for the use of the loop diuretic furosemide is A. Uric acid kidney stones, B. Alkalosis and dehydration, C. History of peptic ulcers, D. Sensitivity to thiazides. And the answer is B. Alkalosis and dehydration. Because the loop diuretics are not as specific and they are causing excretion of many different electrolytes, it can change the ion balance within the body. It can further potentiate alkalosis and dehydration because of fluid loss. Moving on to pharmacologic treatment for gout. Gout is a metabolic disorder which is characterized by the accumulation of uric acid crystals in various joints, tissues, and sometimes the kidneys, with resultant inflammation and pain. Most commonly, gout will occur in the big toe, ankle, knee, and elbow. Oftentimes, patients, if they are having an acute gout attack or they develop chronic gout, they'll actually be recommended to do dietary changes and lifestyle changes as well, including staying more hydrated, trying to limit foods that are high in sugar and salt, and including fish and red meat and things that can cause uric acid accumulation. The example of the medication given here is probenecid, and probenecid is the only one of these that is a uricosuric agent. And what that means is that probenecid blocks the reabsorption of uric acid, leading it to be excreted in the urine. Other medications that might be given are naproxen or indomethacin for pain related to gout. Interactions include penicillins and cephalosporins, which can be potentiated. So their effects will be potentiated by the probenecid, and that can be, sometimes it's given actually for other issues, not even for uric acid formation, but because they want to potentiate the effect. But if that's not your intended goal, we need to be careful about how we're prescribing. Oral hypoglycemics, because it can lead to hypoglycemia through potentiation. Salicylates, because they antagonize the uricosuric action. And then NSAIDs, because probenecid decreases renal clearance, meaning that the NSAIDs are excreted through the urine and metabolized by the kidneys. And so this can decrease how much is being released out of the urine, which can cause a buildup of the NSAIDs in the system. Side effects include headache, nausea and vomiting, and kidney stones, as well as renal colic if a large volume of fluid is not maintained. It's very important when we're taking these medications or when we have gout that we are drinking a lot of fluids. Precautions and contraindications include history of uric acid kidney stones, history of peptic ulcers, renal impairment, and hematologic disease. It's a little bit confusing on this slide because they give you these other medications for pain, but all of these interaction side effects and precautions only relate to the probenecid. So I just want you to be aware of that. That's why I'm kind of focusing on that medication. Here's a picture of a toe, a great toe, which is one of the main areas that gout flare-ups happen. And it shows this uric acid crystal formation and kind of gathering around that site. Acute gout is characterized by the sudden onset of pain, redness, warmth, and swelling in the affected joint, occurring commonly at night and in patients who are not well hydrated. So as I said before, staying hydrated, avoiding or limiting fruit juices, seafood, red meat, and foods high in sugar and salt, those are all things that will help to decrease that uric acid formation and decrease gout flare-ups. Knowledge check. Gout most commonly affects which part of the body? A, joints, B, bones, C, teeth, D, muscles. And the answer is A, joints. Case study activity. A 62-year-old male reports to the emergency room with severe pain in his left foot, particularly his big toe. It is red, warm to the touch, and he states he is unable to wear shoes due to the discomfort. Upon examination and review of labs, the physician finds an elevated uric acid level and diagnoses the patient with A, arthritis, B, fractured toe, C, gout, D, bone spur. And hopefully you got C, gout, as we just spoke about what gout looks like. But anytime you're looking at a case study like this, I want you to kind of break down the parts of it. So sometimes the text can feel like a lot. I would underline in this severe pain in left foot, particularly big toe, right? That's giving us a clue. What are the exact symptoms that we're seeing? Red, warm to the touch, and then elevated uric acid levels. So all the pieces of the puzzle together give you gout. Now, if we didn't have that elevated uric acid level, maybe we would think arthritis, or maybe we would think trauma. We might ask more questions. Did you stub your toe? But giving us all of that information, the case study is really pointing us in a direction. So that's kind of how I want you to break down these questions. Another category of urinary system drugs is antispasmodics. These are used to treat overactive bladder, which is a condition characterized by two urinary symptoms, frequency and urgency. Frequency is defined as having to urinate more than 8 times in 24 hours. Urgency is defined as the sudden need to urinate. And even beyond just the sudden need to urinate, urgency is this sensation of suddenly I need to pee and I have to go right now. If I don't go right now, I'm going to have an accident. So it is like you can't wait once you have the sensation of needing to pee. The treatment of an overactive bladder is the utilization of antispasmodic medications. Antispasmodics help to increase the capacity and decrease the urgency of the urinary bladder. The following are frequently used antispasmodic medications: tolterodine and oxybutynin. Both are used to decrease bladder tone and suppress bladder contractions in patients with neurogenic bladder, resulting in decreased incontinence. So neurogenic bladder occurs when the nervous system's connection to the bladder is disrupted, which causes bladder control issues. And so this helps to manage it by, again, kind of decreasing the tone and suppressing those frequent contractions so that people are not having these incontinent episodes. And incontinence, if you're not aware, means that they're unable to control their bladder and they're having urinary leakage or, having accidents. Side effects of these medications can include drying of all secretions, blurred vision, mental confusion, tachycardia, palpitations, and urinary retention and constipation if the dose is too high. So the bladder antispasmodics, these side effects are anticholinergic. And so we have learned already about anticholinergics and how they cause the drying of bodily secretions. Can't pee, can't see, can't spit. Okay, we know that that's the phrase kind of associated with anticholinergics. So start to kind of make these connections so that you can remember the side effects versus just trying to memorize them. Knowledge check. When diagnosing an individual with an overactive bladder, urinary frequency is defined by urinating more than blank times within a 24-hour period. A, 4, B, 6, C, 7, D, 8. The answer is D, 8. All right, now we're going to talk about urinary analgesics. Remember that analgesics are used for pain relief or pain control. Oral urinary analgesics, or local anesthetic for urinary tract mucosa, is used for a short time to relieve burning, pain, discomfort, and urgency associated with cystitis, also known as bladder inflammation. It should not be taken for more than 2 days when used with an antibacterial agent. Example of medication is phenazopyridine. Some common brands for that is Azo or Pyridium. So those are ones you may have actually heard of more so than this generic name. Side effects can include headache or vertigo and GI disturbances, and could present discoloration of bodily fluids, including orange-red urine, or cause discoloration of contact lenses. The orange-red urine is a very distinct color that you can tell when someone urinates, oh, they're on, this phenazopyridine. So just something to be aware of, and something that we talk about in patient education so that people aren't scared when that happens, because especially with red, people might think it's blood or that kind of thing, but it all comes from like the staining of this medication that it causes to the urine. Precautions and contraindications include impaired kidney function, and the use of phenazopyridine may interfere with blood glucose measures and urine ketone and protein kidney tests. So if they are taking certain tests, especially urinalysis, it may interfere with the accuracy of those tests. The image below demonstrates what can happen if a urinary tract infection goes untreated. So urinary tract infections are actually one of the leading causes of severe sepsis in our elderly. And it shows here this kind of zooming in, and the bacteria, the white blood cells are trying to fight that, and then these superbacteria are growing, and the white blood cells are unable to get the infection down. So if somebody has cystitis, or a bladder infection or a urinary tract infection, we can look at these urinary analgesics, but we also as a treatment, but it's not a treatment for the actual infection. So they also need to be on an antibiotic of some sort. These remember are just used for pain relief. Moving on to our cholinergics. Cholinergic drugs stimulate parasympathetic nerves to bring about contraction of the urinary bladder in cases of non-obstructive urinary retention, usually post-operatively or postpartum. So cholinergic, as opposed to our anticholinergics that help to reduce bladder spasms, the cholinergics help to cause contractility to help urine that's being retained move out of the body. Example of medication is bethanechol. Side effects can include GI cramping, diarrhea, nausea, vomiting, sweating and salivation, headache, bronchial constriction, slow heartbeat or reflex tachycardia, orthostatic hypotension, and urinary urgency. So remember, we have the opposite of our anticholinergics, so this is increased secretions. CP, spit, etc. Okay. Precautions and contraindications include obstruction of the GI or urinary tract, hyperthyroidism, peptic ulcer and irritable bowel syndrome, asthma, cardiovascular disease, Parkinsonism and seizure disorder, and pregnancy and lactation. Knowledge check. Which is not a known side effect for cholinergic drugs? A, hyperthermia, B, sweating, C, slow heartbeat, D, GI cramping. And the answer is A, hyperthermia. Benign prostatic hyperplasia treatment. Benign prostatic hyperplasia, BPH, is a condition that we treat often and the most common benign tumor in men. And if you're not familiar with the word benign, it means non-cancerous. BPH involves hyperplasia, which is an increase in cells leading to prostate enlargement. So it is this overgrowth of cell reproduction leading to the enlargement. And this interferes with urinary flow because the prostate sits right next to the urethra and can start to compress it. There are 3 medication categories that treat BPH, including anti-androgens, which work by suppressing prostate growth and associated urinary obstruction and manifestations. Alpha blockers, which block alpha receptors found in smooth muscle in the bladder, neck, and prostate, causing them to relax. So that allows urine to flow more easily through the urethra. And then phosphodiesterase is a PDE inhibitor and is used for the treatment of erectile dysfunction. But it was also recently approved to treat the signs and symptoms of BPH when taken daily. This slide shows a little bit more in depth about each of these. So anti-androgens, finasteride, and dutasteride. The purpose is to suppress prostate growth and associated urinary obstruction and manifestations. But an androgen is one of your sex hormones, so like your testosterone. So the side effects are impotence, decreased libido, decreased ejaculation, and gynecomastia, which is breast tissue development, again, abnormally. And since this is typically given for men, this would be breast tissue growth in men. Side effects will diminish after the first year of treatment. Alpha blockers, medications are tamsulosin, doxazosin, and terazosin. These block alpha receptors found in smooth muscle in the bladder, neck, and prostate, causing them to relax and improve urine flow. These are what I see given most often, especially tamsulosin. The trade name is Flomax, and that's exactly how I describe it to patients. It's going to kind of loosen and open everything up to allow urine to flow more freely. It can be that simple when you're doing patient education, and I want you to think about that when you're doing your medication pamphlets, because we really want patients to be able to understand what we're saying. So we need to be mindful of the words we use and make it more simple. The side effects of your alpha blockers are dizziness, headache, nasal congestion, orthostatic hypotension, palpitations, ejaculation dysfunction, decreased libido or sex drive, and impotence. Last, your phosphodiesterase. The medication name is that they give is tadalafil. It is a PDE inhibitor used for the treatment of erectile dysfunction and recently approved to treat the signs and symptoms of BPH when taken daily. Side effects are hypertension and fainting. Knowledge check. Which BPH treatment blocks alpha receptors in the smooth muscle of the bladder, neck, and prostate? A. Anti-androgens. B. Phosphodiesterase. C. Alpha blockers. D. Beta blockers. The answer is C. Alpha blockers. Self-assessment. Remember that you can use your self-assessment to kind of check and make sure that you got the main points from the lecture. You also have a lot of resources in your book at the end of each chapter, including quizzes and little knowledge checks beyond what we do here in the lecture. The questions are: 1, can you explain the 4 categories of diuretics and their side effects? 2, what are the 3 medication treatment categories of BPH? 3, can you explain the cause and treatment for gout? Thank you for listening. This has been Chapter 15, Urinary System Drugs in Essentials of Pharmacology for Health Professions, 9th edition.